Everybody. My name is Dr. Krista Clancy, and I'm really glad that everybody is able to join us today. I'm here to talk to you about a webinar entitled MCHAT 101, an introduction to the MCHAT screening tool and its importance. This is a project that was out of the Michigan Innovations in Care Coordination, and our project was funded by the Michigan Health Endowment Fund. So today we have a few things on the agenda to speak with you about. We're going to start by talking about autism diagnostic symptoms. We're going to talk a little bit about early screening for ASD and what that looks like. We're going to also talk about ASD diagnosis and then applied behavior analysis, which is the recommended evidence-based treatment that people are referred to if they do get an ASD diagnosis. And then we're going to talk a little bit about the importance of care. And then in the second half of our presentation today, we're going to talk about some very specific steps that care providers can take in order to improve care and care coordination. So just wanted to open up our disclosure for learners. This is our disclosure for learners document, and you're more than welcome to go ahead and pause at this point and take a look. But we have no conflicts of interest to disclose for this presentation. So other than that, I'm just going to go ahead and move forward and get us started. So our learning objectives are as follows. First and foremost, we would like participants to be able to identify signs and symptoms of autism spectrum disorder. In addition to that, we want our participants to understand evaluation and applied behavior analysis services for people with autism, as well as the barriers to that. So participants hopefully will learn to administer the MCHAT-R and the MCHAT-RF electronically. And then we're going to offer some advice on how those providers can better advise parents and families on the next steps when there is a concern for autism following the MCHAT. So just to get us started, we're going to talk a little bit about autism spectrum disorder in general. So autism is a neurobehavioral symptom. It's caused by problems within the central nervous system, and in general, it affects the child's development. So typically, we can make a diagnosis within the first 3 years of life, and parents actually notice concerns with their child usually much earlier than that. Some parents have reported 9 months of age, 12 months of age, but definitive diagnoses can be made as young as 18 months old as well. So symptoms are more noticeable when you have children with ASD, when they are exposed to more difficult tasks. And when they're kind of in a social situation is when we tend to notice more difficulties within these children. There are 3 general areas of concern, and I'm going to talk a little bit more about each of those areas. So the first is impaired social interaction. The second is impaired communication. And then the third area is restricted repetitive behaviors of interests and activities. So I'm going to start us off by talking a little bit about the lack of social skills. So often people notice with people with children with autism, first and foremost, they tend to have poor eye contact, but also you tend to notice a lack of interest. Sometimes kids resist being held, or they might stiffen. They often don't respond to facial expressions, or when you smile at them, playing peekaboo and things like that. It's not always something that you get the same response from a child with autism as you would from a typically developing child. Often they don't have a lot of joint attention or reciprocal type of social interactions when they're young. So like if you go, hey, look, and you point at something, they're not often going to do that or join in with that. We also often see a lack of initiation or sustaining play with peers. So that seems to be a deficit as well. Thinking a little bit about play skills, we mentioned that they don't really respond well to appropriate facial expressions, but they also don't tend to make appropriate facial expressions for the situation. And again, because of that lack of initiation or sustained play, they often are not taking part in groups. You might notice that either they feel very anxious in strange situations, or they may not feel anxious around strangers at all. Sometimes our proximity is a little bit off, so maybe they're too close or too far away, and that really impacts the ability for the child to play In addition, there are communication skills deficits. So some children with autism have a complete lack of language at all. You don't really see either verbal or nonverbal language. There's not a lot of communicative intent. Sometimes we just see more rote or repetitive behaviors when it comes to communication skills. Sometimes you see echolalia, which is repeating what others say without really having a good understanding of what that means. Sometimes they use language, but they don't use it very effectively to engage and communicate well with other people. You might see for a young child, one of the first things that we often hear from parents is that they don't respond to their name when their name is called, but they do sometimes respond to other sounds in the environment that are more meaningful. Like if the iPad comes on or their favorite television show comes on, they might respond to that, but other types of things in the environment that you would expect them to respond, maybe not so much. If you do have a lot of language for a child with autism, sometimes they use it, but they don't use it for good conversation skills. And they may not engage in really good pretend play because of this lack of communication skills as well. Last area to kind of talk about with autism diagnostic type symptoms is this repetitive stereotype pattern of behavior, interests, and activities. So a lot of times we have motor skills types of oddities such as spinning or rocking or kind of odd hand movements. Sometimes we don't see much of that, but we see really insistent in routines or rituals. Sometimes you see kids that are more obsessed with different activities or certain toys. You might notice that kids might play with a toy inappropriately. Maybe they're playing with a car, but they're just focusing on spinning the wheels or something like that. So sometimes you have an odd response to environmental stimuli. So maybe if they get hurt, they may not respond in the same way, or you might see some children are very sensitive to certain stimuli, or maybe not sensitive at all in their environment as well. So moving on to how do we detect these things? So some of these things are within the normal developmental limits, and some of them are not. The best thing that we can do is make sure that we're using good screening and surveillance tools at all of our developmental well child visits. So you want to make sure that you're using the MCHAT screener. This is something that's recommended definitely at 18 months, 24, and 36 months. And we also want to make sure that not only do we administer this, but we also spend some time talking to parents to really discuss what their concerns are and what they're seeing. So if you are going to administer the MCHAT is a 23-question questionnaire, and each question is indicated as yes or no. It's valid for children from 16 to 30 months, and it measures all of those things that we just talked about. So there's questions that help to detect deficits in social communication and those repetitive behaviors. The test itself takes about 5 to 10 minutes to complete and score. And you can get the MCHAT for free. So it's available for download. You can use this link here, or you could just do a Google search for MCHAT screening. And then you should be able to find both the MCHAT screener as well as the scoring sheet. The MCHAT is also translated into several different languages. So if you're looking for resources for people who English is their second language or they don't speak English at all, there are also some free resources there. There's 3 different areas that could indicate potential risk or not risk. So the first is low risk, which is if they answer between 0 and 2 points on the MCHAT once you score it. And really this indicates that you don't really need to do anything. There's really not a lot of risk at that time, no reason to make a referral. If they get a score of between 3 to 7, then this is indicated as medium risk. And there is an alternative form called the MCHAT RF, which is a follow-up form. And this takes an additional 10 to 15 minutes to interview the parents to talk a little bit more about some of those questions and try to really pull out whether or not those things are really things that indicate risk or not. So you could complete that. And then once that's scored, you could determine whether or not you need to make a referral. But if the parent scores the child between 8 to 20 points on the MCHAT, then that's going to indicate high risk. And that's going to be an immediate referral for a comprehensive evaluation to determine whether or not they have autism. So that leads us to the next step, which is really a little bit more about what does the diagnostic process entail? So typically, if you are going to get an evaluation to determine whether or not you have autism, the diagnostician is going to start with the history. So they're going to review records. They're going to talk to any other, the parents or get information from any other providers that have seen this child up until then. There also needs to be a medical or a physical evaluation just to kind of rule out if there's any medical causes. Typically, we're going to want to make sure that there's a hearing test, and there might be some other neurological things that we might be looking for before we decide to go forward with the full evaluation. We definitely want to start with a developmental interview with parents or guardians. Really, whoever knows the child best should be the one that answers those questions so that you can get a nice history and any concerns that might be happening in the home environment. And then there's always a direct child evaluation. So the practitioner is going to be doing some direct observation, and typically this is done through the ADOS. And the ADOS is a standardized assessment that's really the gold standard for detecting autism symptoms. And this is called the Autism Diagnostic Observation Schedule. So this is something that's almost always recommended when we're trying to identify whether or not somebody has autism. In addition to that, we're looking at some other psychological evaluations. So we want to assess the cognitive skills of this individual as well as the adaptive functioning skills of this individual, both because we want to know whether or not there might be other things going on, like maybe cognitive impairment or other kinds of diagnostic issues that we need to kind of do a definitive diagnosis between autism and something else. But also, even if they do meet the criteria for autism, we also want to know what that cognitive and adaptive functioning is, because that's going to help us to determine what services are needed and what kind of prognosis. Finally, the last thing we want to take a look at is any mental health assessments that we might also do in order to rule out other types of mental health issues. Sometimes speech and language deficits, anxiety, obsessive compulsive behavior, ADHD, these are all things that kind of co-vary with autism. And we want to determine, are these behaviors part of autism? Are they part of something else? So it's really important to also assess those things. So when we think a little bit about this process, this is not an easy process for parents. And both parents and professionals agree that we need to have an increased amount of support and guidance throughout the diagnostic process. Parents are reporting typically that there's a lot of stress, things are not clear, they're difficult to understand, and they often leave the diagnostic process without really knowing what is the next step. So this is a really important piece that we're going to talk about in a little bit. Before we do that, though, let's talk a little bit about ABA. So ABA is the recommended intervention for people with autism. It's based on learning theory and it's evidence-based treatment. So basically what happens within ABA is target behaviors are chosen, and then those things are manipulated with things in the environment. So we're working on real, observable, measurable behaviors, and we're using data and all of these different environmental variables to kind of manipulate and make decisions about how we want to change behaviors so that we can motivate the learner to behave differently. So the idea with ABA is that individuals are learning skills. So autism comes with a lot of skill deficits. So I talked about play skills deficits, social skills deficits, communication skills deficits. These are all things that we can help increase through ABA. And then we also can target some of the problem behaviors that we're going to use to hopefully decrease some of those things. Now, ABA can be used to positively impact a lot of different areas. Pretty much any behavior that can be increased or decreased is something that can be targeted with ABA. So we're targeting learning behaviors specifically, things like attending, things like imitation, being able to look around in your environment and be able to learn from that particular environment. We're also targeting a lot of general language skills. So communication, daily living, social skills, motor skills, these are all areas of development that are typically delayed, if not one. Sometimes multiple areas are delayed within autism. So we want to target those areas to make sure that we're trying to catch up any skill delay at the same time that we're teaching some of these learning behaviors so that it makes it easier for them to learn from their natural environment. In addition to this, as I said, we're also targeting concerning behaviors. So anything that is problematic, we're also looking to hopefully replace that with more appropriate behaviors. So ABA is not a simple intervention. It's typically something that takes many hours of time and quite a commitment. How long a child is going to be in treatment is really going to be different for each child. What's recommended is typically 20 hours a week or more. The earlier you start, the better. Before the age of 2, you tend to have a much better outcome than what you would have if you started the intervention later at 3 or 5. But in general, no matter what the age of the child when they start, you do show progress towards whatever goals are targeted. And the bigger the deficits, the more difficult it is to kind of target some of that. So some children are going to become indistinguishable from their peers. If they continue to have lots and lots of intervention, they may actually learn the skills that they need to learn from the natural environment and kind of go forward without a lot of intervention in the future. Some kids are not going to do that. And that's really going to, again, depend on how many deficits they have when they enter therapy and how much therapy they actually get within ABA. So some general treatment recommendations for ABA, as I said, the earlier the better. That's the most important thing, is get kids into services as soon as we suspect that there's ASD. But in addition to that, when we use ABA, we want to make sure that we're using strategies that are going to help generalize. We're going to make sure that we have good transitions between activities that we're working on. We want to make sure that the families are really involved in treatment. This has been found to be one of the most important variables for success. We also want to make sure that there's a lot of consistency between home and school and other community environments. And what's at the heart of ABA is a very small ratio of instruction. So often we're doing one-on-one, but when we're not doing one-on-one services, it's usually 1 to just a couple of kids or a very small group, because that increases the number of learning opportunities that each individual child is receiving. As I said, we're looking at 25 hours a week of direct intervention at an early age. And we're looking to solve these problem behaviors, as I said, using really a functional approach. So we want to understand why the behavior is occurring, what kind of maintains it, and what motivates the person to engage in that behavior. And then we want to try to undo those things and replace those with more appropriate behaviors. There's a lot of structure when we're thinking about ABA and the type of intervention that we're doing in the teaching environment that we're putting together. And also, we want to make sure that we're kind of looking at that predictability and that routine to make sure that we're getting enough learning opportunities in, that kids feel comfortable within their environment, within their learning environment. And in addition to all of this, we want to make sure that not only are they getting this one-on-one individual instruction, but there's also a lot of opportunities to facilitate that social interaction with peers, because as we mentioned earlier, that was an area of pretty big deficit for individuals with autism. So now that we know a little bit about autism and what it looks like and how we might identify it early and figure out what the steps are, I think it's also important to think a little bit about the system of care and what does it translate when we have to go through all of those steps in order to get access to the thing that's going to help us. This is actually really complicated. So there's a lot of steps, from the pediatrician to the diagnostician to the ABA provider, and sometimes other things in between, depending on what comes up with those assessments and whether there's any medical issues that are going on or other kinds of comorbid issues that are arising as part of the diagnostic process. So you can imagine there's a lot of opportunity for errors on both the provider's end, but also on the parent's end. And then if either the provider or the parent makes an error or misjudges what's going on, there's a lot of opportunity for children to fall through the cracks and not make it through this complicated system in a timely way. So this can be pretty overwhelming for parents. Having a lot of appointments and a lot of providers to work with really increases the opportunity for error. And one thing that we do know is the more professionals that are involved with child's care, the less satisfied and the bigger decrease we have in mental well-being for the family of that child because of all of these additional things that are happening through the process. So we really want to consider that as we're thinking about how do we handle these families? How do we work with these children and make sure that we're supporting them in a way that's going to be helpful and not adding additional barriers to what they need to do actually. So there are some general barriers to early diagnosis and treatment. Just kind of going back to that complicated system of care, if we don't have access to regular pediatric visits, that's one of the biggest areas where we can end up having a delay in diagnosis. Because if you're not going into the doctor regularly for well care visits when your child is young, then your pediatrician may not have the opportunity to actually do these screenings and then identify any risk that may be happening. Another barrier to identifying ASD is parent knowledge. So sometimes parents are very knowledgeable about what typical development looks like, about, maybe they've had other children or they've been around other children and they recognize right away, hey, there's something really wrong, and they bring those concerns up. Sometimes they don't. Sometimes they think that it's typical behavior. Sometimes they don't bring the concern up. Sometimes they think that something that a pediatrician or some provider might think is of concern, maybe the parents are not concerned about that. So having the parents be more knowledgeable about what those signs and symptoms of autism are can be very helpful as well. And then the last barrier is parent knowledge about the system of care. So if we do identify some sort of a risk, if the parents don't really know, okay, well, how do I go from knowing that there's some sort of risk to getting my child into a diagnostic evaluation, and then ultimately, if they do have some sort of a concern for autism, making sure that they get into treatment at the right time as well. So definitely looking at all of those different areas, there's a lot of places where we can really improve the system. One of the other things that we know about this is that coordination of care can be extremely helpful. But when we don't have good coordination of care, that can actually lead to more barriers and more problems. So not having good coordination of care and not really understanding who's doing what within the system can be frustrating for providers. Providers may not know what the right thing is. Maybe there's a lot of disagreement between providers, and not enough, too many leaders and not enough followers sometimes leads us to kind of going around in circles. Of course, this is going to add additional confusion for families, especially if providers are giving mixed messages. If they maybe don't disagree with, maybe they don't agree with other providers, that can kind of put parents in a really sticky situation, because who do they trust? And then how does that trust impact their relationship with their provider and how they're going to move forward? So when there's a lack of care coordination from all the providers that are involved, a lot of times the parent will assume that role. So again, adding that stress, and decreasing overall family functioning because they're now taking on this additional role. In addition to that, when they have to take on that role of care coordinator, or they have to manage all of these other professionals who could be assisting with that management, it really decreases the relationship satisfaction that they have with all of the professionals involved. So we want to kind of think a little bit about, well, what can you do as a provider? So some things that we're going to think about, and then we're going to talk about these things going forward, is first and foremost, really educating yourself on the system of care for ASD and what resources and providers are in your area. So that way, when parents do have questions about what to do, or even if they don't, you can make really good recommendations and very specific recommendations that can kind of help them navigate through that complicated system. We also want to make sure that providers in your organization, so whether you're a pediatrician working at a primary care facility, or whether you're working in some other area of early intervention or have early contact with children, you want to make sure that you and all of the other providers are completing regular screenings and using tools such as the MCHAT to make sure that if there is any risk for autism, that somebody has identified that risk and somebody has communicated that risk to the parents so that they can hopefully take that next step. Another thing that you can work on is really, as an organization or as a provider, taking a look at what your data looks like at your agency. Are there places where families are falling through the cracks within your organization? And can you identify those things? So that might be something that you can do as well. You also want to evaluate the ability for the providers within your organization to navigate these services. So not only do they know what the resources are and what the providers are, but did they know where the families have to go if they have private insurance or Medicaid, or what some of those navigation skills are to make sure that they can get in, get their evaluation, and then if treatment is needed, that they can get in and get that treatment. And then finally, what education materials and tools can you as a care provider recommend for your patients and for other providers so that people can make sure that you're disseminating the right information, that you're educating your providers and your families to make sure that everybody is kind of going through the process in the most efficient way. So at this point, we're going to talk specifically about the Michigan Innovations in Care Coordination Project in a way to kind of look at how can we as providers start to think about overcoming some of these barriers to access. We're going to talk about this project and then some recommendations that came out of this. So the first thing that we want to do is kind of start with the why. So why are we doing this? Why did we decide that we wanted to really work on care coordination? Well, one of the reasons is because that was kind of at the heart of some of the things that were going on. And with the MICC project, one of the things that we did is we created a open forum of discussion and participation, not only from providers, but from families within the area and people who are familiar with autism, so that we could kind of get their feedback and make sure that all of these stakeholders had a voice within this process. So I'm going to talk a little bit, next I'm going to talk a little bit about some of the objectives and what we tried to do with MICC, and then how we accomplished those things. So the first thing is really, as you can imagine, we were working on improving access for coordination and care, really targeting this population of ASD and IDD, so that we could bring together like all of these people and see like what is the best practice here. Now, we did this by creating two groups. So the first one I'm going to talk about is the advisory board, and then I'm also going to talk about the provider education work group that we created. And through these two groups, we really hope to educate providers and families, as well as to create some tools that would help the workflow of the process and make things easier in general. So if you kind of look at this picture, our overall project MICC kind of was the overarching, I guess, goal or longitudinal, idea of what we were trying to do. Embedded in this is not just education for families, but workforce development and integrating the services so that we could make sure that we have a better experience for families. And as I said, we kind of have these two groups. So our advisory board provided a lot of direction and high-level problem solving to the project. And our provider education work group was kind of like our boots on the ground group. They focused on really doing the projects and kind of collaborating to come up with what the educational work is and, you know, what needed to change at that ground level for those organizations. So it was great that we had a lot of different stakeholders as well. So as I mentioned, we had family members. We also had clinicians, we had public health professionals, we brought in organizational leaders from the community, and we had partners from at least 15 different unique organizations. Some of those were universities, some of those were clinical centers. The clinical centers, we had representation from people in the medical field, so your pediatricians, your medical providers. We also had diagnosticians, we had ABA providers. We had folks from Michigan Department of Health and Human Services to kind of help us navigate the public aspect of this, and then several local and statewide organizations as well. So through this process of bringing all of these stakeholders together, one of the first things that we really needed to do is assess the how. So we knew why. We knew that there were problems and we started with the why. So we brought all these people together. And then the next step is the how. How do we then make this change so that we can get to the right outcome? So the first thing that we did is conducted a survey. And then all of our providers and our families had a couple of different surveys that they answered depending on their role within the group. And from those surveys, we pulled some data, and then we brought that information back to our provider education work group and our advisory board for some really rich discussion within our stakeholders so that we could kind of process this information. So what we came up with is really 3 different areas of concern, or what we call barriers to the system. So the first were provider barriers. And what the providers were reporting is, one, there was a lot of different providers. As I said, lots of different service providers who were doing different things. And one of the issues that came up is each of these individual service providers kind of functioned like a silo, and they didn't really know what was happening once they left their service or what happened before their service. So there wasn't a lot of tracking of these different transitions. And often they would refer families to a service and there would be a big wait list, or the families would come back and be like, yeah, I haven't gotten in yet. So one of the other areas of concern was really understanding, what do all these different providers do? What is the role of these people versus what is my role? And how do we get them through the system a little bit better, more effectively? Communication was also a big barrier for the providers. As I said, they didn't necessarily talk to one another. They were kind of practicing in their own area. So that was kind of putting a little bit of wrench in the coordination of care. And then the providers themselves didn't necessarily know what resources were out there available, and they didn't really know where to refer, and they didn't understand the process of referral and kind of getting from point A to point Z, or however many points of service there might be for an individual. In addition to this, there were a lot of changes in the process. This system of care is a fairly new system of care. Autism services and ABA specifically are newer services that are covered by insurance and Medicaid. So there have been a lot of changes in the system over the last decade or so, and that was really difficult for the providers to manage. And one of the other things that was reported by the providers specifically is when they were going to make a referral, one thing they didn't know is how to identify a good provider or a quality provider from other providers that were out there. And then the final thing to consider is that there wasn't really any tracking of patient satisfaction. So everybody's kind of going through the motions, but nobody's really talking to the families to say, you know, what's your experience here? How's it going? So for our families, some similar things. So again, lack of information on resources, the confusing long process, the extensive wait list. They also had a lot of communication issues with their support coordination services, but also with many multiple providers. And then transportation was also recognized as a specific barrier for families. In the area of insurance and accessing insurance, both providers and families reported that there were different evaluation requirements for different insurances, which was confusing. And there were often changes in the insurance requirements. And then different plans not only had different requirements, but they also covered different things. So that was also very confusing for everybody. And then just the general insurance process is something that was brought up as a specific barrier for everybody. So we created some goals based on this. One, first and foremost, we wanted to improve the workflow process for providers. We also wanted to evaluate current resources that were out in the community because we didn't want to reinvent the wheel. We want to make sure we were using good things that were already there. And we wanted to make sure that we identified the resources that were most helpful to families. There were some gaps, so we wanted to create resources to help empower families to be able to better navigate the system. And then also we wanted to improve the patient, excuse me, the patient engagement with the providers and all of these resources. And then finally, we also wanted to make sure that not only we had educational materials for the families, but also for the providers. We want to make sure that they had a really good understanding of what the system of care was, and then that they also were knowledgeable about how the families responded to those things based on their own individual backgrounds and history. So that was an important piece of information for this group as well. So the short-term goals basically translated to creating some tools and products that were going to support parents and providers in this really complicated and cumbersome process. So each of these things I'm going to talk about individually as we go through the rest of the training here. So now what I'd like you to do is I'd like you to actually get out your phone, and I would like you to scan this QR code. If you don't have your phone and you can't scan it, this is the website that you can go to. But I'd like you to take a look here real quick. And I'm just going to show you what our webpage looks like. So on our webpage, you are going to have access to all of the different materials that I am going to mention for the rest of this talk. We're going to go over some videos and also some documents that you're going to have access to. So I want to make sure that you're aware of that. And you can save that for later in hopes that you might want to use some of these resources, both for yourself as well as for the families that you work with. So the first thing I want to talk about are the videos that we have. The videos were created. There's actually a series of 4 videos, and the 4 videos go through the process for the families of getting an MCHAT all the way through getting ABA services. And this was our attempt with the goal to try to engage parents more with the process and try to empower them so that they felt more comfortable with the services that they needed and how to get from the beginning to the end. So for our parent videos, one of the things that we really focused on is making sure that they were very parent friendly, making sure that the way that the script went and the visuals that you saw within the videos were diverse, short, easy to understand, really straightforward. So that was really our goal. Video 1 covers the MCHAT and the MCHAT process, what it is and what ASD is. So that kind of educates them on some of the basic steps that you would first encounter. The second video has to do with understanding insurance and what you need to do in order to get an evaluation or kind of the next steps for this evaluation process. Video 3 talks about early intervention and differentiates what is early intervention versus early intensive intervention. And what can you do now while you're waiting for an evaluation? And what can you think about, or how do you research to determine what's going to be the best thing for your family? So that's video 3. And then our last video, video 4, is really just about understanding the process of ABA and what it is to receive ABA and what you can kind of expect from that process as well. So that's one of the first things that we created for families. And then the next things, there's two specific documents that also help to educate parents and could be used for providers as well, but they kind of give some information, some background information about the process, and they can be used as a reference guide in addition to the videos so that they have something that they can kind of go back and refer to. So the first one I'm going to talk about is the MICC Insurance Guidance Flowchart document. Basically, this is a short document that highlights three different scenarios. It talks about, well, what if my insurance covers ABA? What do I do? How do I get access to it? What if my insurance does not cover ABA? What are my options? And what if my child has Medicaid coverage? So it goes through each one of those scenarios and kind of gives a step-by-step and a decision-making process when needed, as far as what information they come up with. So like I said, really great for parents who are seeking more information about ABA and ASD services. And the right time to take a look at this document is right after they had a positive MCHAT or there's any concern for autism, so that they can kind of take the next steps with understanding how to get an evaluation and then ultimately services if they need them. The next document is the MICC ABA guidance document. This is also intended for parents. It can be used for professionals as well who are not as familiar with ABA. It's a detailed guide that really helps to get information out about different considerations for applied behavior analysis. So, of course, it's targeted for people who already have a diagnosis of autism, because those are the people that would be accessing the applied behavior analysis services. So this is really intended for families, parents of children with autism after they receive a diagnosis. So that way it can help them to determine, well, what choices do I have within the ABA provider process? And, what exactly do I need to be considering as I'm looking for that provider? In addition, we created a whole table of contents and basically a resource repository. Again, this can be used for parents. This can also be used for providers. This is really intended for providers to be able to have these things at their fingertips. So that way, when they want to refer a parent to one of these particular services, they can very easily send it out. But parents could also access this and kind of go through and see what they think that they need. And I'm going to show you how we can utilize this in a really effective way once we get in talking about our workflow process. But it can be used at any point during the journey. It can also be used for people who do not have autism. There are some things on here that might be useful, financial services and whatnot. So the idea is it really helps providers to kind of target those things for the families. There were two additional surveys that were created specifically for Wayne County Community Mental Health, but are also posted because there might be some utility for other service providers. So the one is a provider survey, which kind of gives the logistics of the company and some clinical concerns. It's a questionnaire targeted to providers so that they can kind of give information. If payers are going to use this would be a great way to create a resource directory of different providers and the different services they have. If providers were going to use this specifically, it might be a way to assess their own services and then communicate the different details about their service to the consumers that they're targeting. The last survey is the Applied Behavior Analysis Customer Satisfaction Survey. And this is targeted for providers who are providing ABA services to be able to evaluate whether or not their parents and consumers of their service are satisfied with the overall process, with the treatment planning process, the staff, the relationships between the staff and the family, how the service was provided, the accessibility of the service, and the overall effectiveness of that particular service. So again, this is posted on the website as well, and it can really give providers a lot of information about things that they may need to change or do differently, and really target that customer satisfaction. So the final thing I want to talk about today is our workflow. And as I said, we had a variety of different stakeholders, one of which was Patient Education Genius representatives. Patient Education Genius is a healthcare technology company, and their their product, Patient Education Genius, is a dashboard that's used to improve communication, improve operation efficiency, data collection, financial performance, and ultimately successfully engage clients in a different way. So we were very intrigued by the services that they provided for providers, not necessarily ASD providers, but they were working in other medical care areas. And we thought that this might be really useful for our providers for ASD. So I'm going to show you a little video.
What I'm going to be showing you right now is how to log into the Patient Education Genius system. You're going to start here by accessing the link that we'll provide for you. You will have a username and password provided to you. I'm going to go start by logging in with the WSU username, user account, and their password. You click the sign in with email. I will warn you, sometimes it takes a little bit of time. I think they're maybe like 5 to 10 seconds. It's thinking right now, as you can tell, loading. Great, now we're here. We're at the Patient Education Genius homepage. Over here on the left-hand side, you have your surveys and your resource repository materials that you will send to your families as needed. Here's the MCHAT survey. I will show you how to demo that. I will demo that later on in the presentation. Up here in the right-hand corner, you also can look at tracking to see what's been sent to people and whether or not they have opened your account, and that's how you'll sign out. Going back to your library takes you back to that homepage where we currently don't have anything favorited, but this is our PEG homepage, and we'll be showing you a bunch of other things on this homepage as we continue throughout this training.
So what we're going to be able to do here is walk you through the process of utilizing PEG and the dashboard that they have with all those really handy folders, and how we've incorporated all of these materials directly into PEG as a way to improve workflow and improve communication between different providers. So of course you can utilize all the materials that I've already mentioned as a standalone just by going to our website and taking a look at those things, but these things are also incorporated into the PEG dashboard. So one of the things I haven't talked about yet is one of our attempts to improve workflow was to improve how the MCHAT and the MCHAT-R survey were administered. So with people often missing their well care visits, and with kind of the situation that we're in right now, we were also looking for a way to kind of make it easier for the provider to get the survey out and then also have the survey scored and adding some automaticity to it. So at this point, the MCHAT survey can be sent electronically. It can be sent in 2 ways. So it can be sent with a text to number. So the families can text the number, text MCHAT to a specific number, and then that survey can come right to their phone or to their email. So that's the first step in the improved workflow, which is the patient filling that out either by the text to number or by the email. And we'll show you a video of this.
What I'm going to show you now is how a provider would log into Patient Education Genius homepage and how they will send the MCHAT-R survey. So again, this is your homepage. You're going to go over on this left-hand side. You're going to choose this folder that says MCHAT-R. You're going to click on it here. This is how the folders appear. So you can send the information to a patient. You're going to click the send button here. You can enter in a phone number and you want to, or an email address, and you want to separate it out by a comma. You can do multiple, you can send to multiple places, a phone, an email. I'm going to show here is how we'll send it to my email address. Again, you can add more than one, you can add in a phone number, you can add in additional emails, but for the for this example, I'm just going to show you how I send it to my email. You click send, so the MCHAT-R survey is going to be sent to my email. It says success, your patient education materials were sent successfully. Okay, I am also going to then pull up the email that I received, and I will bring it over to the screen that I'm sharing. So if you just give me a moment, it's currently in the cloud. It can sometimes take a little bit of time to get in an email box, but it's actually pretty quick. So there's the email that you would receive, a message from Wayne Health. So a patient would click on the message, and this is what's going to pop up. They are then going to see the survey for them to complete, the DWIHN logo, some advertising information for early on. And then if they click here on the survey, it's going to take them to the survey that we've shown you earlier in this presentation, the MCHAT form, again, the consent information, and then their information that they'll go ahead and start entering for filling out the MCHAT form. And they scroll all the way down here, and that's how they'll submit it. So again, that is how you're going to go into the folder, and you're going to send it to a patient that way. So you can also view what you're sending to them by clicking that view button. It'll show you what they're going to see. That's another feature. And I believe that's it for now.
All right. So if you decide that you wanted to use the PEG platform and you wanted to improve the workflow for how you're going to send out the MCHAT or how you're going to provide your families the MCHAT, this is one way to do it. So as you saw, they could either send a text to receive the MCHAT. So you could give that to them as a flyer. You could post it on your website. You could have something posted in your office and you could have them log in live time. You can also send them something ahead of time. So like Danielle was saying, you can go ahead and plug in their phone number, or you can plug in their email address. You can send surveys to a whole group of people. So anybody who was coming in for an 18-month-old well visit could also get this. This is what it would look like if the message was sent to them, which basically they would just click on the link and then it would open up the same thing that you already saw from Danielle's presentation of the MCHAT survey. So the patient information is entered pretty easily. If this is your computer or your phone that you're filling it out at your own personal device, one of the nice things is it's got a lot of automatic fill features. So you enter your information, you talk a little bit to the patient about the consent, and then they are then able to fill out the MCHAT. So the consent language is in there. Currently, this is part of the MICC research project to determine whether or not this is a more effective way to provide MCHAT surveys to families. So we're looking to see if families can access services better and faster. So there is a consent information in there to participate, which the family can read on their own, or the clinician can spend a little bit of time talking to them about that as well. But basically, here's the process. So the family starts by completing the MCHAT. Now, with this system, the MCHAT is automatically scored. And if the MCHAT is neutral, as we talked about previously, if it has that score between 3 and 7, where the MCHAT RF needs to be given, that automatically populates in the survey. So as the family is filling out, as the parent is filling out this survey, if they hit the point where they need to now do the MCHAT RF, then the additional questions populate in there as well. Each of our providers that participate with this also have access to all of the data. It all gets stored on a Google Sheet. Everything is HIPAA compliant. It's a pretty low tech, dashboard, low cost. All the information kind of comes to you, and then you can review that information in your Google dashboard. Once you take a look at that then helps you to decide, okay, well, what's my next step for interacting with this parent? Is this a parent in my office? Is this somebody that I have to contact because I sent the surveys out independent of an office visit? So we're going to take a look at the Google dashboard so you can see how the data looks.
Again, it's Danielle. At this point in the training, I'm going to show you the Google spreadsheet. That's what I'm sharing with you all right now. This is how a provider will view the information after a family or patient completes the MCHAT survey that they provide to them. This is how the fields and the information are going to show up on the back end. Each of the provider offices is going to be given a unique login so that they can log into their Google spreadsheet with their username and password. We're going to provide that to you all in a user quick reference guide. So that'll be provided to you so that you can have access to this Google sheet. But after a parent and family fills out this MCHAT survey, here's some of the demographic information that's going to show up. And if you continue to scroll over, you will get to the actual MCHAT questions. They begin here in column V. And the ones that are in yellow, you'll see are the ones that are reverse scored, questions 2, 5, and I believe question 12. As you continue to scroll over, the information and how a family fills out the survey is going to be down here. These are just test surveys that we've completed out or that we filled out to test the survey. And as you get over here to column AP, the total MCHAT score is going to be right here. So this is going to be the total score for the first 20 questions. And if a patient scores in that neutral range, they're going to automatically get the questions for the MCHAT RF. And again, if you continue to scroll over here, you're going to see some of the questions for the MCHAT RF. And if a person leaves any of the fields blank while filling it out, it's also going to show up blank on this spreadsheet. So again, we'll continue to scroll over. Some of the fields are left blank. So again, they're blank on the spreadsheet. If we continue to scroll over all the way to the right, there will be like a total pass fail column that we're still going to have the PEG team make a few last minute updates, and they're going to add that information in here. So there'll be a total pass fail column for quick reference for a provider office. And so that's some of the changes that we're going to be making, but this is close enough to what it's going to look like that we felt that it would be valuable enough to do the training. So that is what the Google spreadsheet is going to look like and how the data is going to be provided to a provider's office. Again.
So at this point, we have a couple of updates. One is that the provider can see both a score for the MCHAT and the MCHAT RF if the MCHAT RF was actually administered to the family, so that they can see whether or not the child passed the RF. One of the other things that we have created is an automatic care coordination effect. So the family may get an opportunity to have their results, if it's positive, sent directly to Medicaid if they are Medicaid eligible. Our prototype here is in Wayne County, Michigan, which is a high population of children with autism who get referred to Medicaid from their pediatric offices if they have a risk for autism. So we've also added some things. And then if it is that the family has chosen that they want their information to go ahead and be forwarded to be considered for the Medicaid evaluation, then that information will go right over to the Wayne County Community Mental Health Agency. Now, if you're not in Wayne County, or if you're not connected in that way, one of the things that we can do is all of our different partners, we have an opportunity to set up individual partner relationships where we can figure out what is the best way to get the information to the family and the messages that you're going to send. So those can all be individualized during the onboarding process. But what I want to bring your attention to is how we're going to use the educational materials. So let's say you are a physician and you had the family complete the MCHAT, and the MCHAT indicated some concern for ASD. So now you have the opportunity to go into PEG and select the content folder number 1, which is preloaded with parent videos 1 through 3 and the insurance guidance document. So I'm going to show you what that looks like and how easily you can get that information out to parents once you have identified some concern for ASD.
This is the PEG homepage. You're going to scroll down to the left here, where you would see pre-populated resources folder number 1, pre-populated resource folder number 2. You're going to click on folder number 1. Right now, and as I mentioned, we only have one item loaded in here, and that's the MICC video number 1, is my child at risk for autism. And you will click on the folder, you will choose the content. If there are more things, you can click on them each and send them separately. This little pops up, and this is how you send the materials. You can enter an email or a phone number. You separate them by a comma, and then you just click send. So for example, I will put in my email address here, and I will then receive a link to the video to watch it. Once this loads, I'll also show you what that content will look like when a person receives it. I'm not sure if you all can see this loading screen, so just bear with me for a moment. Yep, so it says it was a success. So what they will see when they receive the email or a text message is just a direct link to our YouTube channel, and it'll show that video that was created, help direct patients and families.
So you can see how easy it is to send that information to the families. So we have a pre-populated content folder number 1, which is which includes the resources that I had listed there. And then we also have a pre-populated folder number 2, which is intended for families to receive after they have a positive diagnosis of ASD, which includes video 4 and the insurance guidance document. So pediatricians can send this information out, community mental health representatives can send this information out. It can be sent, like I said, to more than one person at a time. It can be also, you can send multiple documents. The great thing is all of this information is at the physician's fingertips or the provider's fingertips, and it goes directly to the family's device, whether it's their phone or their email on their computer. And now that information is there and they can re-access it over and over again. I just want to give you, before we end today, a final little flow chart for what this looks like, so that you can kind of think about whether or not this would be something that would be beneficial for you and your organization. But the workflow basically starts with having the family get the MCHAT. So either they have a text to, or the provider sends it to them directly via email or text. That family then completes the MCHAT, and if they're eligible, they can check the box for Medicaid. And then from that point, if there is risk for autism, they can definitely receive all of our educational materials. At the very same time, the provider in real time can be looking to see, if there's anything else that they need to have sent. They can see whether or not the family has opened it. If the patient is Medicaid eligible, or they'd like to know whether or not they are eligible, that information is directly sent to the Medicaid representatives Google dashboard as well, so that they can have that information, and then they can follow up directly with the families. And then the family will receive a welcome message if they then make that selection that says, hey, your information has been sent to this other provider, and they're going to be contacting you at some point. So the next step in the process, all of this, like I said, happens together along with getting those educational resources. But then the next step is if they are deemed eligible for Medicaid, or if they are going on, they would get their evaluation. And then ultimately at the end, they're then going to be referred for ABA services if they qualify. So the most important thing here is that we have considered all of the barriers for the project that we came up with. So the patient barriers, the provider barriers, getting out those educational materials and being able to really determine what the best materials are to give to families. If you're interested in working with us, if you want to know more about the process, if you think that you might want to maybe partner with us and talk about what onboarding would look like, feel free to reach out. And again, take a look at our resources out there. And if you are interested in having this education for CME training, then you need to reach out to Danielle Baumgardner, and her email address is there listed as well. Thank you so much, and I wish you luck, and I hope our resources are very helpful to you. Take care.